Hello, this is Dr. Gay from First Look MRI. This is a 60-year-old male with complaints of wrist pain. He has no history of prior trauma, but he does have abnormal x-rays that show arthritis of the wrists. On this view in the left and on the right here, this is the same projection. This is called a T1 weighted view of the wrist, where we see the radius and ulna. We see the carpal bones here, and we see fluid is dark, so nothing is standing out as really dark on this view, but if we go towards the palm, we do see that there's darkness in the palm. On this view, this is called a T2 weighted view. Things look very, very similar, except for fluid, instead of being dark, like on this side, fluid is white. So we're going to go over here and see the fluid over here looking very bright. So we see there's a big fluid collection in the palm. These longitudinal strings here, these are the flexor tendons, so this is fluid surrounding the flexor tendons. There's also something striking here in the carpal bones. These are the carpal bones of the wrist. And this carpal bone in particular, this is the scaphoid bone. It's very small, looks like a little triangle. Normally this is more tubular. This should look more like this bone here, but you can see how it is diminished in volume. And so this goes along with a long-standing arthritic process like rheumatoid arthritis that involves the proximal wrists. Also, we see this stuff here, this intermediate signal, gray intermediate signal. This is synovial inflammation. So this does go along with rheumatoid arthritis with the chronic bony changes, synovial inflammation, and also this fluid collection here. So this is fluid in the palmar bursae. These are potential spaces that surround the flexor tendons here of the wrist and hand. And we'll go into a little bit of that anatomy, but this is something that indicates inflammation of the bursa, and that can be related to rheumatoid arthritis, it can be related to other synovial inflammatory processes, it can be related to infection. Anything that causes inflammation of the bursa will cause us to fill up potentially with fluid like this. When you see a very large collection like this, you think of rheumatoid arthritis or an infection primarily. This is called a sagittal view, looking from the side. This is towards the palm over here, and we see the flexor tendons. These dark look like cables here, and the white is the fluid in the palmar bursa that surrounds those flexor tendons of the wrist and going into the palm here. This is an axial view, short axis view, where we're going through the same area. You can see the line corresponds to this, and we see the bones here. This is the thumb, and this is the palmar aspect, and these dark bands are the flexor tendons. And you can see that white stuff, this fluid, surrounding these flexor tendons. So the flexor tendons are compressed by this large fluid collection. This is just severe inflammation involving the palmar bursae. So there's a couple bursa in the palm here. One is over on this side here. This is called the radial bursa. And this is the flexor pollicis longus tendon here that goes to the thumb. And there's a bursa here that surrounds this tendon, and it goes all the way up into the thumb. This is our last cut, so we can't see how far up that goes. And there's also another bursa over here that surrounds the other flexor tendons. There's 1, 2, 3, 4, 5, 6, 7, 8. So there's 8 other flexor tendons. The second, third, fourth, and fifth deep and superficial flexor tendons. These go to the second through fifth fingers. And this larger bursa here is called the radial bursa. I'm sorry, the ulnar bursa rather. So this is the radial side, ulnar side. So the ulnar bursa is large, and that goes distally, and it goes around, it surrounds the flexor tendon of the fifth digit here. So this radial bursa is in the palm, the wrist, and it goes into the thumb. And the large ulnar bursa surrounds all the other flexor tendons, and it goes about the flexor tendon of the fifth digit here. Now we're going to take one look here. This is the ulna radius, or in the proximal wrist. These are those flexor tendons. This is that tendon that goes to the thumb. So again, this is the radial bursa. This is the big ulnar bursa. And as we go here more distally, it goes through the carpal tunnel, which is right here. And distally, we see this balloon out, these 2 fluid collections, 1, 2. And again, this fluid collection will go around the flexor tendon to the thumb. This will go around the flexor tendon to the fifth digit. And these 1, 2, 3 fingers here, they have flexor tendon sheaths that are usually separate from this. And that's it. So inflammation of the palmar bursa, again, these 2 main bursa, and also the flexor tendon sheaths of these 3 are the 3 main components. And these 2 usually communicate with each other at the level of the carpal tunnel here, and often they're so large it's hard to appreciate the communication, but it looks like it may be right here where these two communicate. Right there, there's that tiny little communication in the channel, and here's the other fluid collection. And that's it. Thank you very much.